Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know, I am MD in Ayurvedic Medicine, Kai Chikitsa, and MD in Ayurvedic Physiology, that is Kriya Sharir. For paid online consultation, of course, you have the WhatsApp me on 92268 which is given in the description also, that particular number. My dear friends, as you know that we are running a series that is a TV serial, Ayurveda in GP, that is Ayurveda in General Medical Practice. Today we are going to discuss one of the very common complaint nowadays regarding the sleeplessness or insomnia. डॉक्टर क्या करूं, मेरे को नींद ही नहीं आती. तो इसके बहुत सारे रीजंस हो सकते हैं. इंसोम्निया as a matter, you can say it's a very casual problem, or it can be diagnosed as a serious problem. So here we are just taking some very casual causes of the insomnia, but basically there may be some serious causes that the person may be having some systemic problem. Like for example, anywhere pus in the body, anywhere pain in the body. It may be the toothache, it may be the ear pain, whatsoever. There may be some cancer-like growth in the body. So this and that, there are n number of causes for not getting the proper sleep or the disturbed sleep. Even the change in the sleep rhythm is a very serious indication in the cases of liver cirrhosis patient. Just I want to warn you, I'm not afraiding you, but for example, if you have any patient nearby who is having a liver cirrhosis because of the lot of drinking alcohol, and that patient one of the day becomes land into the unconsciousness, and that means going towards the coma. So hepatic coma is a very serious condition, and in that condition, it is an irreversible condition. That particular patient may die even because of the hepatic coma. So to prevent hepatic coma, one must know the warning signals. For example, they have the what you can say, the tremors-like symptoms or irrelevant or uneasiness, and the most important is change in the rhythm. The person keeps awake at night and he always sleeps in the daytime. So this pattern is totally changed because of the disease condition of the liver, that is liver cirrhosis. If for the days together the patient is complaining of headache, then you must go for MRI or the CT scan of the brain, because there may be some problem, space occupying lesion or the tumors, benign or the malignant or the cancer in the brain, which is causing the sleeplessness problem. But forget about those serious causes, that will be tackled by the consultants. But today we are discussing very common problem, like for example, stress. Stress is the main cause for not getting the sleep, and the patient having the lot of domestic problems, society problems, office problem, financial problem, children problem, this and that, and there is always a disputes in the partners and all these things. So it makes a person always an overthinker, and that overthinking, psychological stress, is the main cause of the today's problem. Then excessive screening time, because insomnia is related with the vata and pitta basically. Vata imbalance or the pitta imbalance. Vata is imbalance because of the irregular lifestyle. Fast food plus fast lifestyle is equal to fast degeneration of the cells. Similarly, if the pitta is irritated, if your sattva guna is not properly working, and there is a dominance of raja and tamo guna. Raja is over activity, and tamo guna is like ignorance, lethargy, and the depression and all these things. Blackness, total functioning of the blackness of the mind. So these a balanced mind or the quiet and tranquil mind is a success key for getting a proper sleep. But another thing, Ayurveda says why the person is sleeping, because yadatu manasik klante klamanvitaha karmanvitaha. When after the whole day activity, physical and mental activity, the person's senses and person's mind is getting tired and the person wants to sleep. Now, this is the physiology mentioned by Ayurveda, the cause of getting the sleep, because our physical body and the sensory organs and the mind is tired because of the activity. If the whole day the person is lying lethargically and sedentary lifestyle, no exercise, no work, then that can cause the sleeplessness. He will not whole day, if he is sleeping daytime, that is a very bad. If he is not doing any exercise, that is bad. That will cause the problem of sleeplessness. And only taking the pills, that will make you addict. Daily tranquilizer, daily anti-stress tablet, that is not good. So best way is to get sleep, work properly, optimal work, optimal physical, regular exercises of 1 to 2 hour walk should be there. Your food habit should be normal. Sattvic food should be there. If you are always taking irritating food, that will not make you sleep properly. Always spicy, pungent, chili, sour, these are very bad. Soothing food should be there. For example, even milk, the buffalo's milk is better, which will increase the dopamine and the serotonin level in your blood, which are the what you can say, the enzymes or the hormones related with your tranquility of the mind. So all these things has to be taken care. Screening time, for example, all the day you are on the mobile, all the day you are on the computers, all the days you are going to the cinema, movies and theaters, and television is in front of you. That makes a problem with your pitta dosha, and that irritation can also cause the, then your what you can say, the temperament is always, you are hot tempered person, then how you are getting going to get sleep. So all these factors should be tackled with the doctor, with counseling. Counseling is very important. Case taking is very important. At the same time, your food, lifestyle, then external treatments like Ayurveda, the full body massage is a very relaxing stress management program. And for insomnia patient, we always advise Abhyangaha Acharet Nityam. At least once in a week, once in a fortnight, once in a month, you should get a gentle full body massage, number one. Number two, there may be basti, yapana basti. If the patient having a weight loss, then yapana nourishing bastis, medicated enema are good. And the most important is the Shirodhara treatment. Whenever we get the shower on the head with the oil or the buttermilk, Ayurveda says that is the best treatment for getting the relief from the insomnia problem. Only medicines is not good. All these things, whatever I discussed, you have to take care of. Even your digestion makes the difference. If you are having irritable bowel syndrome, if you are having the acidity problem, constipation problem, how you can get the sleep? So basically, treat your physical and mental problems, and then go treat the insomnia with some tablets. Okay. So stress is the one of the factor. Old age, automatically vata dominance is there. You becomes a less sleep. Then vitiated vata, as I have discussed, two types of vata disturbances are there. Dhatu kshayajanya, that may be deficiency of protein, carbohydrates, or fats, or your dhatus, rasa rakta mausmed asti manja shukra, may not have the uttama sarata. Sarata is a quantitative and qualitative examination of the body dhatus that you have to take care of. You are all the dhatus. If you are anemic patient, you will not get the proper sleep. If you are the overweight, you will not get the proper sleep. Do you understand what I am saying? If your diabetes is uncontrolled, you may not get the proper sleep. If your BP is uncontrolled, you may not get the proper sleep. So all these systemic problems should be corrected. And second is margavarodhajanya vata prapop. If there is any ama, toxins in the body, then you must detox your body by panchakarma. Okay. So treatment, rule out the cause, and if there is no dyspnea or any pain or any major pathology that I have discussed, then following treatment can be given. Then Khurasani Ova, now I will mark the different prescriptions for you. Let us see one by one. Khurasani Ova, 100 milligram plus Shatavari Churna, which is nourishing. This is tranquilizer, 500 milligram. Ashwagandha Churna, very nourishing and increasing the tranquility of the mind, 500 milligram 3 times in a day. Then Prashama in the liquid as well as tablet form from Ayurveda Rasashala Company from Pune city. Ayurveda Rasashala Prashama, 4 teaspoons with equal amount of water at bedtime. Then Manas Mitravati, 2 tablets in the evening or at bedtime. And Allersin Company Siladin tablet, 2 tablets at bedtime. Apart from that, another prescription, Sarpagandha Ganavati, simple beginning, 2 to 3 tablets at bedtime. Massage with the Brahmi oil, especially for the head region. Then Nidrodaya Rasa, this is a specific tablet for insomnia. In Ayurveda, generic medicine, 2 tablets at bedtime, and Khurasani Ova, 250 milligram at bedtime. Then Pathya, the most important thing, you have to avoid the stress and overthinking. Take a long walk for 1 hour in the evening. Massage with the Mahanarayana Tail every day in the evening or before bedtime, if possible. Otherwise, weekends or fortnightly, before bedtime, have 1 glass of full of buffalo milk. Try to read the literature that will pacify the mind, or chant Ramanama or any mantra, I am saying. Or soothing music is also very helpful. That is called as a Gandharva Chikitsa. And practice Shavasana, a typical posture of yoga, Shavasana, that is relaxing for you. So my dear friend, this is a very interesting thing that you have a lot of what you can say, the choices to recover from your insomnia problem, and don't make you addicted with the sleeping pills. So I wish you all the best. Take care, and don't forget to subscribe my YouTube channel and subscribe my YouTube channel and press the bell button icon. That is very important to get the notifications. Thank you very much. Take care.